Hi, my name is Katlyn Arndt. I completed the Brent Fellow in Neurology and Medicine at the Mayo Clinic in Rochester, Minnesota this past summer. The Mayo Clinic is a large nonprofit medical center with 3 locations in Rochester, Minnesota, Jacksonville, Florida, and Scottsdale, Arizona. They focus on patient care, research, and education. They are ranked as the 3rd overall hospital in the United States, ranking first in numerous specialties. They have over 60,000 employees and over 1 million patients visit the Mayo Clinic every single year. I worked on a variety of projects in the Cognitive Neurophysiology Lab with Dr. Eric St. Louis. These projects included the analysis of sleep deprivation and the analysis of sleep disturbances in epileptic patients. For the sleep deprivation project, we scored cyclic alternating patterns in the brainwaves of patients, and from now on I'll refer to cyclic alternating pattern as CAP. There are 3 subtypes of CAP, A1, A2, and A3, and these are organized by their frequency, where A1 has a lower frequency and A3 has a higher frequency. A1 is said to be sleep preserving, while A2 and A3 are said to be sleep fragmenting because they cause central nervous system arousals during sleep. The patients participating in the sleep deprivation project stayed in the hospital for 2 weeks, and this included an adjustment period, a sleep deprived period, and a recovery period. We predicted that there would be a decrease in CAP rate and A3 subtype rate and an increase in A1 subtype rate. This is the program that we use to score CAP. It's called HypnoLab. The 3 main segments on this screen are called epochs, and they represent 30 seconds of the total recording of the night. And the segments underlined in blue are the CAP segments. And in order to be considered CAP, the segment must be 1/3 higher in amplitude than the baseline and be at least 2 seconds long. So as you can see, this could be quite a tedious way to analyze things. It took about 5 hours to analyze each recording for a night. And we're still collecting data and analyzing the data, so I don't have any results to present to you for this project today, but just an overview of what we did. And the second project that I worked on was the epilepsy questionnaire. The purpose of this project was to analyze sleep disturbances in adult patients with epilepsy and determine if these disturbances affected their quality of life. And the study was a prospective survey-based questionnaire completed by epileptic patients who had been seen at the Mayo Clinic Rochester in the past 2 years. We recorded a variety of measures including sleep apnea, restless leg syndrome, sleepiness, sleep quality, fatigue severity, morningness, eveningness, depression, adverse events, anxiety, and quality of life. I had a variety of responsibilities with this project as outlined here. Our questionnaire was 36 pages long, and it consisted of 21 surveys, which we compiled and formatted. This picture is of my coworkers and I, and we are getting the surveys ready to be sent out to 960 patients. And thankfully, we didn't have to lick 960 envelopes. We are currently collecting and putting the information into the database. We have received 91 surveys back so far, which is about a 10% response rate. And over the next few months, we're hoping to increase this response rate in order to strengthen our arguments. We did a preliminary data analysis with the 91 surveys we have received back so far. And since we had so many variables, I'm just going to talk about a few of the associations that we looked at today. I'll talk about 3 variables: adverse events due to prescription medications, seizure frequency, and depression. And we observed an association between quality of life and all 3 of these variables independently. And so we made a multiple regression model in order to predict the quality of life using these variables. So in this model, on the y-axis is the actual quality of life, and on the x-axis is the predicted quality of life. The R-squared value for this model was 0.714, and since that number is close to 1, it means that the model predicted the quality of life well. In addition, the p-values, which are shown here, are all less than 0.05, and this indicates that each of the variables contributed significantly when predicting the quality of life. So what did I learn? Through these projects, this fellowship has exposed me to many different research techniques and skills that I can apply later on. I further enhanced skills such as developing hypotheses and literature review and also data analyses. Some of these projects also required me to view patients' electronic medical records and interact with patients via phone. And in these circumstances, it was very important to protect the patient's confidentiality and privacy. I also had the opportunity to gain experience working with the IRB, which is an ethical review board. And through the epilepsy questionnaire, I learned how to submit applications and modify applications to the IRB. From a professional standpoint, I learned general skills such as communicating clearly with my coworkers, as well as thinking critically about our projects. And from a personal standpoint, I got a taste of what life will be like after Cornell. I lived on my own in downtown Rochester, which is shown here. And I also worked about 40 hours a week, so kind of an idea of what will Cornell be like after. Or what yeah. This fellowship has exposed me to the clinical research laboratory and also a healthcare setting. I also had the opportunity to reinforce concepts that I learned in classes at Cornell, especially research and data analysis skills. And I will be able to further enhance these skills through future opportunities for publications and presentations from this research that I did this summer. I also had the opportunity to interact with many different levels of healthcare professionals, including doctors, physician assistants, nurse practitioners, and many more. I had multiple opportunities to shadow physician assistants, which is the career that I'm interested in. I shadowed them in the areas of sleep medicine, emergency medicine, and vascular surgery. And one thing I noticed about almost every single Mayo Clinic employee is that they are truly passionate about what they are doing, whether they're diagnosing patients, conducting research, or simply helping a patient find their way through the clinic. And this mentality has allowed me to gain confidence to follow my passions in the medical field. I would like to thank all of the Cornell Fellow donors for their generous donations in order to make this fellowship possible. I would also like to thank Dr. Eric St. Louis, who is my site supervisor, for his guidance and support throughout this fellowship. He has given me many opportunities to grow academically and professionally, and I could not thank him enough. I'd also like to thank my faculty sponsor and advisor, Craig Teague. Through his support, I have had the opportunity to achieve many great things at Cornell, including this fellowship.